Welcome to my poster. I submitted a proposal for a workshop. It wound up getting accepted as a poster. This is a poster presentation version of what was supposed to be post-conference workshop 4 at Sophie 2020 in Atlanta. It was accepted as such, but it was canceled due to the pandemic. The workshop consists mainly of small group problem-solving activities involving scenarios like the ones that I have included in my poster. The problems reveal areas in which we needed to work harder to promote health numeracy. I've used these activities with my undergraduate students, and common reactions to the problems are mistaking measures of central tendency as typical values, thinking of frequency distributions as necessarily symmetrical around means rather than skewed, confusing proportionate mortality with risk of dying, looking at the numbers so quickly that they're given inadequate scrutiny, mistaking rankings of causes of death as indicators of risk of dying from a particular cause. All sorts of errors like that can be revealed. I believe these numeracy challenges reveal vulnerability to deception by people who misuse statistics, tables, and graphs, often to sell you stuff, often to create fear needlessly. I argue that promoting health numeracy should be part of the professional preparation of health educators. Here's a problem that's not in my poster. In October 2021, Senator Ron Johnson introduced legislation designed to block vaccine mandates. He argued that they were an outrageous trampling of civil liberties. In his presentation for that legislation, he argued using data from England. He argued in England, of the 600,000 new cases of Delta, of the over 2,500 deaths, 63% of the deaths, 1,613 people, were the fully vaccinated, 28% with the unvaxxed. Now, he's trying to leave the impression that you're more likely to die if you're vaccinated. Let's say the data he presented is absolutely correct, but the data do not support the interpretation that he was leading you to believe. Why not? Well, one part of it is called the base rate fallacy. You might expect there to be more deaths among the vaccinated if there were many more vaccinated people than unvaccinated to begin with. And that's especially true if the people getting vaccinated are the people at the greatest risk of dying if infected. So I don't think most people can catch on to that. We need to work on promoting health numeracy. What do you think?